The data that we had were collected from surgeries between 2004, so just after cross-linking was introduced into ophthalmology, so between 2004 and 2009. The surgeries were at IROC and ELSA Institute, both in Switzerland. So I'm just give you an overall from this period. We had around more than 400 surgeries, but to evaluate actually the long term after 10 years, you can imagine we could not reach all of those patients again. Some of them did not have the follow-up completed, so we end up analyzing 50 eyes. And what we see, there are many details here, but in summary, what we could see is that, as expected, cross-linking could stabilize keratoconus progression. About the visual acuity, let me just look here, one table that I have. So we had around 50% of the patients with stability of visual acuity, and this was more or less one line stability, and 36% actually had improvement of more than one line after 10 years, which really surprised us, because that was not initially the idea. The idea is to stabilize, but we could see that many patients had also improvement in visual acuity. And from the baseline, so before cross-linking and 10 years after cross-linking, we saw a decrease in keratometry. The Kmax, just as overall parameter, it's not the ideal, we know, but just to have an idea, decrease in the Kmax around 1.5 diopters in 10 years. So that's quite a lot, considering that there is a long time interval. But I would say what we were most interested about was understanding how visual acuity in long term would change. So this is a challenge actually that we have to say to patients, okay, how my visual acuity can stay over a long period, and that's still a challenge actually. And as I said, 50% stay stable, but we would like to see, was there anything that we could predict? So worsening of visual acuity, for example, so any risk factor of changing visual acuity. So we could not find any relations regarding with age, and also with any Scheimpflug measurements like maximum keratometry or any other parameters, but we did see some correlations with preoperative visual acuity. So in other words, the most severe visual worsening that we had was in those eyes with the best preoperative visual acuity, and therefore there are other studies saying this as well. It confirms that a good preoperative visual acuity can be a risk factor for visual acuity changes. So that was maybe the what we find most interesting. So we, of course, had some failures of the treatment, and we could not evaluate in the whole period of all patients, but we did evaluate the treatment failure, which is a long-term complication, we could say like that. So from 42 eyes that had only that had not other procedures, refractive procedures, we saw that 2 eyes require re-cross-linking, so a second cross-linking, and one of them had 32 and the other 19 years old. And then another eye needed keratoplasty, so DALK, and the patient, this one was also young. At the time of cross-linking, he had 25 years old. And another 3 eyes progressed, so Kmax increased in the overall period. So we could say with those patients, that those numbers that I just present you, that the overall, like the cross-linking was able to stop the progression of keratoconus in around 85% after 10 years. So That was our main outcome about the failure of the treatments. Once we understand better the outcome, so how the cross-linking, the cornea reacts to cross-linking long term, of course, we are also able to manage better and also improve our indications. One of the curiosities we found that the two youngest patients in our series, both of them had 9 years old on the day of the surgery. They did stay stable after 10 years of cross-linking. So such small informations are also very valid, because there is a discussion whether the turnover, collagen turnover from the cornea, how long it would be, and also the impact of the age on the efficacy, on the long-term effects. But we could see, at least here, two patients very young, 9 years old, that were still stable 10 years after cross-linking. Of course, it doesn't mean they will stay for more time stable, but they show us very important information in the long term. So it was very good to see those results and to understand a bit more on long term.